Welcome to the Nocturnal Fitting Guide. In this video we're going to be discussing myopia management. I'm Scott Brown, optometrist at Scotlens. So Ortho-K is the kind of original myopia management mode. Back in 2005, Pauline Cho published the LORIC study which showed there was I think around about a 40% reduction in axial length increase in the group of kids studied. Since then, gone on, Ortho-K is one of the most studied topics regarding myopia management and vision correction, and you can see that there's nearly 80 peer-reviewed studies being published a year now. And what's come out from that is the understanding that this distance center multifocal cornea that we create following Ortho-K creates a peripheral defocus shell. So this is the image that you'll be familiar with, where we've got this peripheral image is pulled in with the peripheral ad. And it's the corneal changes that come from Ortho-K that facilitate this. This has then been replicated with soft lenses and now in spectacle lenses as well, this principle of peripheral defocus. This study, this meta-analysis from Mark Bullimore, says that it's the underlying mechanism from the cornea in Ortho-K that causes this reduction in axial length growth. And what we see from this study is that it's not the different brands of Ortho-K that make a difference, it's the actual corneal shape left behind by the Ortho-K wear that's causing the peripheral defocus. That means that we get the axial length change. So it means that kids have got, without the device being worn, they're getting this correction, this myopia management all the time. So we've got lots of peer-reviewed data, and the kind of figures that come out from it are suggesting that we're getting a sort of similar reduction in myopia between soft contact lenses and Ortho-K, given this multifocal kind of vision. If we look at, so this is information from the BHVI, Brian Holden Visual Institute, we can see that they've got predictions for the myopia that kids are going to develop. So if we take an 11-year-old -2, we can see that they're going to have a predicted outcome of coming out about -3.37 according to the research that they've got. And looking at Ortho-K in general with peer-reviewed studies, we see that there's about a 44% predicted reduction in the myopia. So this is all fine from clinical data, but how does it actually work when we see it in practice with observational data? So this is the group of kids that I've been fitting over the last few years. You can see it's kids fitted from between 2009 to 2021. The youngest was 5 years of age, with an average age of fitting being fairly typical for a Caucasian group, being 12 years of age. Average starting prescription -175. And the maximum years worn in this group was 11 years. And you can see out of this whole group of wearers, we see a refractive change shift of -0.73 diopters. This, of course, is a large group, and it includes wearers that have only worn the lens for a year. So if we look at a group of wearers that have worn the lenses for 5 years, and that take this 11-year-old group, so this is a group of 10 wearers, and 11-year-old starting age with a -2 prescription. Again, from the predicted outcome, they would expect to change -1.37 diopters. What we see with this group is that they actually have only changed 0.3 diopters of change. So that's a 77% reduction overall. Now that is a refractive change, not axial length, but you can see it's certainly a visible amount to be noticing in practice. Importantly, within the group, there was variation on how much the kids progressed, but all of the kids progressed less than the predicted outcome of -1.37. Now, some practitioners are choosing to fit smaller optic zones in order to try and bring the peripheral defocus in earlier. All of these kids were fitted with the standard optical zone that comes with the nocturnal lenses, so the larger optical zone, giving them the best possible distance quality vision that they can get. But you can specify smaller optic zones if you want to. So this really means that kids and parents love this mode of correction. Kids get this opportunity to have a childhood where they have kind of naturally free vision during the day, able to do lots of different things, and at the same time they have this potential beneficial side effect of reduction with myopia. So thanks for watching the video. Keep watching the other videos in the series. If you've got any further questions, you can email lab@scotlens.com, and thanks for watching.